Welcome to the lecture on personality disorders. What is your personality? Well, it's what determines how you interact with other people. If it's not healthy, then you can develop a personality disorder. And this starts when you're very, very young. Now, today I'm going to be reviewing different personality disorders. And in class, we're going to be going over just a few of the more common ones, but you are responsible for all the ones that we go over in the lecture as well. So you should know there are three types of personality disorders. There's the eccentric, called cluster A, the erratic, called cluster B, and the anxious, called cluster C. You don't need to know which cluster these belong in. There are 10 total personality disorders. So the most common ones are going to be under cluster B, borderline and antisocial. And you might see in some charts, patient has cluster B traits. And this is what they're talking about, that they have some signs of personality disorder, usually borderline or narcissistic or antisocial. And then cluster C is the anxious type, but the most common one you might see there is obsessive compulsive. So let's start with the clinical picture. What are some of the common characteristics? Well, these individuals have difficulty with self-identity or self-direction, how they see themselves, how they identify with themselves. They have a lot of trouble seeing who they really are. They have a lot of problems with empathy or intimacy in a relationship, which really affects all social interactions. They have a lot of trouble recognizing that there's even a problem with their personality. They think everything is fine. And then to let you know that personality disorders exist on a continuum of severity. So some people with mild traits of personality disorder or traits of cluster B could be considered normal, and then there are the people that have the more extreme variations of the personality disorder. Let's look at paranoid personality disorder. This is Shaggy. Scooby also has a paranoid personality disorder, if you haven't seen this cartoon. Very similar as a teenager to paranoid personality disorder. Usually you will see it in childhood, and they'll have social anxiety. How they behave with other people is uncomfortable sometimes for them. They get very paranoid and jealous and controlling as adults. Maybe not when they're children, but as they grow up, this is how they appear. They also project blame on other people, and they're not willing to forgive those who have done things to hurt them. The treatment for these people is to try and counteract their mistrust by, one, adhering to schedules and avoiding being overly friendly as a nurse. Kind of be neutral but kind at the same time. And then psychotherapy is a much better type of therapy individually than it is as a group for them. They have trouble seeing into themselves, and they may think other people have issues, but they don't. So psychotherapy would work better. And short-term antidepressants while they're going through therapy will help people with paranoid personality disorder. Now, schizoid personality disorder. This is more popular in men than women, and about 5 out of 100 people in our population have a history of schizoid personality disorder traits. Batman is one of them. So is Dexter from the cartoon. They're reclusives. They avoid people and social interactions. They're kind of detached and they're doing their own thing. And they can be uncooperative as patients. Schizoid personality disorder can be treated, but usually it's difficult because if they see you as too nice or friendly, they try and take advantage of that. So you don't want to try and increase their socialization. It's too uncomfortable for them. But assess for the symptoms the patient is reluctant to discuss. What is it that they don't want to have out there to be discussed? So also, because they are kind of this reclusive, they tend to be, in a group setting, they tend to be the people that people make fun of. So try and, as a nurse, you need to protect them from that. And then their treatment, psychotherapy and group therapy may work for them as long as they're protected. Also, as far as medications, they can be treated with antipsychotics, antidepressants, and anti-anxiety medications as well. And then for schizotypical personality disorder, this prevalence is 1 to 5 out of 100 people. Again, more men. So here we have Willy Wonka, and we have Kramer from Friends. And their characteristics, they're very suspicious. They have some distortions in how they see things and how they think about things. However, they can be made aware of these. The nurse can help them see that these are distorted thoughts and perceptions. They have a lot of trouble in social situations, and they can be very anxious. Think of Kramer and how anxious he always is. Treatment, supportive psychotherapy, definitely for them, because they can be made aware of their distortions. Also, cognitive and behavioral measures like CBT, cognitive behavioral therapy, is a great method for them. Group therapy can work for them if they are in a group where there's somebody that's like them, so they don't think they're the only ones with this disorder. And then low-dose antipsychotics and antidepressants for schizotypical. So nursing care guidelines, you have to have respect. They need that social interaction. So if they don't want to go to groups, try and ease them into it. Be aware of and intervene appropriately if they're really suspicious of something, to try and talk them down from that and maybe see them the irrational thoughts that they're having. And always make sure there's diagnostic assessment going on in case behind what they're saying is the issue they are actually having suicidal thoughts. Trying not to judge them or ridicule them, even though they have a very bizarre affect and different from other people. Sometimes can seem so odd, it's almost humorous. What about histrionic personality disorder? Well, that would be Elaine from Friends. And also the gentleman, I can't remember his name, but here from Zoolander, very histrionic, which means seductive, flamboyant, very dramatic. They want a lot of attention. Hey, look at me, look how good I look. But their personalities can be very shallow. And it's all about external looks. But if they have a lot of attention and then it is withdrawn, then they become very depressed and even suicidal, and they're very hurt. Now, as far as treatment, psychotherapy is the main treatment of choice for them. And guidelines is that they have to kind of be made aware of what's going on with them. So you need to be professional and kind of know that when they're trying to be seductive, that it's a response to them feeling uncomfortable. So try and ignore the flirtations as best you can. Model language that's appropriate, that's concrete. Kind of help them, instead of focusing on external things, to help them clarify how they're feeling inside. And then teach and role model how to be assertive. A lot of people with histrionic personality disorder don't know how to be assertive. So by teaching and role modeling that will actually give them a coping skill. Narcissistic personality disorder, actually this is more prevalent in women, but the example I have here is the evil queen, who definitely has an exaggerated sense of herself. But also the one I have above is Michael from The Office. He's holding a mug that says "World's Best Boss," and he probably actually gave that to himself as a gift or brought it himself. He has these feelings of exaggerated self-importance and feelings of entitlement. And most people with this have this as well. They don't have a lot of empathy, and they tend to exploit others at their own benefit. Their self-esteem is very weak, but they are hypersensitive to criticism, but they don't admit that their self-esteem is great. They will say things like, "I am smart." So they can convince other people to believe that. They need admiration all the time, so they will grandstand about themselves. And they don't have any like problems functioning. There's no impairment there. So the treatment is usually psychotherapy, but only if they acknowledge that they have some narcissism. Sometimes they can't. And then group therapy, if they put them in a group, maybe it can help with empathy, maybe not. Now, lithium is a great drug because they have mood swings up and down, and this will help them even out. And antidepressants as well helps people even out. So let's look at a case study here. We have Jim and Mercedes who are beginning marriage counseling together in hopes, Mercedes says, of saving their marriage. The therapist quickly notices, though, that Jim seems to think a lot of himself while putting Meredith down. When she expresses hurt, he either laughs or manipulates her into feeling guilty or backing down. The therapist also notices that Jim frequently boasts about how successful he is, as if he needs the therapist to know and admire about him. So he's grandstanding. This is how good I am. As Jim and Meredith's marriage therapist continues to work with them, she quickly discerns that Jim is not interested in changing his attitude or his behaviors towards his wife. Although Meredith, like Jim, is financially successful, Jim manages all of the finances, and Meredith feels he exploits her income for his own advantage. Jim is hypersensitive to criticism, feels that as the smarter male partner, he is entitled to a greater share of control over their money. Jim is diagnosed with narcissistic personality disorder. Given what you know about the characteristics of this disorder, what intervention strategies would you predict to be the most helpful in working with Jim? Seeing how he is not able to see that he has a narcissistic personality disorder, he refuses to admit these things, then the individual psychotherapy is not going to be a benefit for him. So, let's look at nursing care. Again, remain neutral, avoid any power struggles or becoming defensive. Try and role model what empathy looks like. While you're there with Jim and Mercedes, or if the therapist is there, or you're there talking to them, be empathetic towards Mercedes so that he can see that without at the same time taking all the attention away from him to make him shut down. Now, treatment, very difficult, like I said, since he doesn't see his need for help. But CBT, if he's willing, cognitive behavioral therapy can help maybe get rid of some of these faulty thoughts, these irrational thoughts he has about himself. And group therapy, like I said, maybe for some empathy. Lithium is a great choice if the person has some rage or mood swings. Avoidant personality disorder. Prevalence is 2.4% of the population. Here I have Michael Jackson, other than performing, was an avoidant personality type, and Charlie Brown. They both have low self-esteem. They have extreme shyness that as they get older, it increases. And you might have seen that with Michael Jackson over the years or heard about it since you were not growing up in the age he was. Feelings of feeling inferior and always having to prove yourself that you're good and you're better. And they have this reluctant to engage with new people. They fear how they're going to be judged. So they have a lot of anxiety and depression and sometimes anger because they're preoccupied with rejection and being humiliated and failure. And if anybody gives them any idea that they are being humiliated or rejected, then they do become angry and depressed. So guidelines for nursing care, to be friendly, accepting, and reassuring. Accept their fears that they have. Let them know that they're not abnormal. Group therapy works because they see other people who are like themselves and might have some things to offer in the way of coping skills. And help them in group therapy exercise some of these new social skills that they're learning. And try and when they're in therapy, therapists try to make sure they assign them exercises that are designed to help them succeed. They also need some assertiveness training. Instead of anger, to be assertive instead of aggressive in their responses. Dependent personality disorder. In the picture here, if you have not seen What About Bob, the movie with Bill Murray here, it's amazing, and he is classic dependent personality disorder. It's a very funny movie, even though, as I said, mental health is not funny. It depicts it to a T in a humorous way. So about 0.5% of population has this. They really have a high need to be taken care of. They're very submissive. Their biggest thing, not only of being taken care of, but they fear abandonment. And they manipulate others to take responsibilities for them and to plan for them and to tell them what they should do, how they should act. When they're left alone, even briefly, they have intense anxiety. And what about Bob? Bob Wiley here in the picture follows his psychiatrist on vacation because of this extreme dependent personality and cannot stand the thought of being separated or abandoned. He walks into the psychiatrist's office on the first meeting and says, Monday, Wednesday, Friday from 3 to 4 and daily phone calls. And, that's my therapy. And he's very, very needy, and he shows it that way. So guidelines for care, help him address what currently is stressing. Set limits that don't make the patient feel punished, like I'm not going to see you every day. Make it not seem like a punishment. You do not require to be seen every day. It's more like I'm not going to. Be aware of strong countertransference, because there are a lot of people that have maybe been dependent on you, and it's very easy to treat these people almost childlike because of that. And kind of use the relationship as a nurse as a testing ground for training this person to be assertive and not aggressive and not retreat either. Psychotherapy is the treatment of choice for this. So antisocial personality disorder. This would be Newman from Friends, if you haven't seen Friends. He's very antagonistic. He says what he thinks. He doesn't have any inhibitions about saying what he feels, doing what he wants, without regards to other people. He has no empathy, and that's how antisocial personality is. They have no remorse, no guilt. So how do you assess them? Well, they don't tend to answer honestly all the time. So you have to look at yourself and say, are they telling the truth or not? And do a self-assessment. Because they have a problem with getting very rageful if they are crossed, what they consider to be crossed the wrong way. So some nursing diagnoses for them are risk for other-directed violence. They tend to act out aggressively. They tend to get very defensive. And like the other personality disorders, there is impaired social interaction and ineffective health maintenance as well. A lot of these people are the ones who end up as criminals. As teens, they wind up in juvenile detention centers for crimes they commit, and they don't experience any remorse or any empathy for their victims at all. So in class, we're going to be looking at antisocial personality disorder and borderline personality disorder and obsessive compulsive personality disorder, and discuss those, as those are the most common. And I'm going to give you some examples to see about how they interact. And so that's the end of the lecture today. The remaining slides will be completed in class. Please make sure you watch this prior to the class, as we will be talking about antisocial personality disorder. Thank you.